focus on what matters.
Welcome to our virtual event on America's caregiving crisis. I'm Erica Pandy, business reporter at Axios, and I'm coming to you today from Hoboken, New Jersey. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios and the hashtag AxiosEvents. Over the next 30 minutes, we'll discuss how the increased need for caregiving during the pandemic has driven women out of the workforce, and consider how businesses and policymakers can help. Our first guest is the Congresswoman from California, Representative Judy Chu, who's joining me from DC today. Welcome, Representative Chu.
Thank you for having me.
So I want to start by asking you about both sides of the care crisis, right? I mean, a lot of people tend to think of care as just child care, but the pandemic really shone a light on the elder care piece of this. And there are even people who are caring for kids and parents at the same time, kind of the sandwich generation. Why is it important to consider both sides of what's going on here?
It is so important to have a comprehensive caregiving economy. The worry that you have about a loved one is not confined to just a child. It's not just confined to an elderly parent. It is everywhere. And there are so many people who are just totally concerned about what they would do if a loved one does get sick. And that's why paid leave is the ultimate solution, because then you can have the peace of mind that no matter what happens to your grandparent or to your child or to yourself, that you can take time off and take care of them as well as you. So that's why I am so glad that we have this 4-week paid leave in our Build Back Better bill.
Yeah, I want to get to solutions in just a second, but first I would love for you to frame us from, the national perspective that you've got. What are the 2, 3, 4 big things that are broken in the caregiving economy right now?
Well, so many parents cannot afford childcare, and it eats up a third to a half of their income. So in this bill, we say that the childcare cost would not be more than 7% of your income. Also, we are the only industrialized nation that does not have a national paid leave program. Our situation is such that only 23% of those in private industry have any kind of paid leave at all. And so our families don't have the peace of mind to be able to care for a sick or a loved one. And we also don't have enough home-based care. There's not enough quality home-based care so that you can have an elderly person taken care of at home by a qualified person. So our entire caregiving economy needs a drastic overhaul.
I mean, it's one thing that it took us until 2021 to get here, but Build Back Better does have historic funding for the caregiving economy. What's in there? Can you tell us what's in there that's going to get us out of this?
We have $100 billion for childcare, and yes, it would be able to ensure that we have quality childcare, so that childcare facilities themselves can be upgraded. But also, childcare would be no more than 7% of a family's income. Then there is the $150 billion for the home care economy. So we would be able to ensure that there is quality home-based care for millions of older adults, as well as people with disabilities. And then there is the 4 weeks of paid family leave. Now, I wish it were 12 weeks. Because if you have a newborn, certainly you are going to have more than 4 weeks that you need in order to bond with your newborn. Nonetheless, 4 weeks is what the compromise brought us to. And it would replace 2/3 of a worker's income. It would be both for public workers as well as for private workers, and everybody would have access to it.
And for our viewers who don't see the connection between infrastructure and childcare, could you explain why we need care, elder care, childcare, all sorts of care in order to build back better?
Well, we did just pass a bipartisan infrastructure bill. It had a lot to do with roads, bridges, and highways. But we need the workers to be able to ensure that such an infrastructure can be built. And it means getting more Americans out there to work, but we can't get them to work unless our caregiving economy is intact. And so we have far too many that are held back because they don't have childcare. We have far too many that are caring for an elderly person. If we had a functional system, then we could get so many millions more to work. In fact, the paid family leave, just these 4 weeks of paid family leave is estimated to bring 6 million of those in the caregiving economy back to work. So it'll be millions more that can actually contribute to the economy.
We got some really interesting audience questions for you, and I want to reference this one, which it's coming from someone in the culinary and hospitality industry. And this reader is saying a lot of us in the service industry work during hours that others are not working. So, what's the solution for us when childcare centers maybe aren't working when I'm on the night shift, when I'm on the weekend shift at a restaurant or a store?
Well, of course, there is home childcare, home based childcare, not just your traditional childcare centers that are open only during the day. So that would be a possibility. And of course, there would be the ability to provide support for that. And let me just say that it's affordable childcare for children ages birth to 5. There would be increased wages for the early childhood workforce, and there would be an investment in childcare quality and supply. And so that is something that could expand the kind of childcare that's available, not just for childcare centers, but for those who might be able to take in children on a more irregular schedule.
Right. So there's that flexibility sort of built into it. And
Yes.
then another important reader question: what kind of mental health support should we be providing for care workers?
Oh, it is so important to have mental health services available. Let me say that this bill extends the ACA subsidy, so it makes insurance affordable for all. Now, what we did during the American Rescue Plan and for COVID was to lower the cost of premiums for the Affordable Care Act. But this will disappear unless we extend it in Build Back Better. And the Affordable Care Act does have as one of its benefits, one of its mandated benefits, access to mental health care. So the bottom line is truly that you have the health insurance that will allow you to access mental health services.
And I want to turn for a second to employers. There's often a stigma around caring for family members. You have to sort of hide and pretend you're not doing it, try to do your job at the same time. What can companies be doing to help out, those who are caring for their family right now?
Well, first of all, I just really want to emphasize that small business welcomes paid family leave. I know this because I'm in California. We were the first state in the nation to have paid family leave. And I would like to explode the mythology that small business doesn't want it. And in fact, by having this and offering it freely, small businesses will not have the employee turnover because workers know that they can take some time off to take care of their loved ones, but most importantly, come back to work. And in fact, I have to tell you that in California, 99% of employers said that the state's program has had positive or neutral effects on employees' morale.
And then before you go, I want to ask you, are you hopeful? Are you confident that we'll be able to get this done and get these 4 weeks on the books?
We are pushing very, very hard. It, as you know, was at first 12 weeks, then taken out totally, then 4 weeks put back in. And so far, so good. We hope that it can stay in there. There is basically just one senator that is objecting to this. And we're hoping that this senator can be persuaded to keep it in for the good of the country. We will know soon, certainly by the end of the week, how it will be able to fare in the House. Then comes a number of negotiations on the Senate side, and that will really determine whether it survives. I hope everybody can raise their voices, though, to say that this is important.
Thank you so much for your time, Representative Chu.
Thank you.
And now I want to turn it over to my colleague, Kristen Burkhalter, who is the Senior Vice President of Creative Strategy and Events at Axios, for a View from the Top segment.
Thank you, Erica. I'm now looking forward to a conversation with Avra Siegel, who is the head of U.S. policy programs at Meta. And thank you, Meta, for sponsoring this event. Hi, Avra. Welcome to Axios.
Hi, Kristen. Thanks so much for having me.
No, really looking forward to this conversation. Definitely a worthy topic and near and dear to both of our hearts. So let's just jump straight in. What is the biggest shift over the past 18 months or so in how Meta is approaching their support to family caregivers?
Absolutely. And, the last 18 months have been hard. They've been hard for people who have to balance their home and their work lives. It's personal, as you say, to both of us. You're a mother of young children. I'm a mother of young children. I also care for my father. And so I'm part of that notable sandwich generation. And balancing it all has gotten even harder. Times are really uncertain. People don't know how they're going to get by and really rise to the challenge of all the things that they need to do to live and thrive. And so it's really a testament to trends we were already seeing. Women have already been bearing the disproportionate responsibilities of at home in terms of caregiving and domestic responsibilities. And the pandemic has really exacerbated that. And so it's become even more important for employers to support employees so that they can be successful at work and also be successful at home. And in many ways, the pandemic offered an opportunity. We really had to, at Meta, rise to this challenge and get creative. And so we offer, in addition to bolstering the programs we already have that support working families, we had to think about what we could do that was new, that was responsive to the challenges of this historic time. So there's a few things we did that I want to just highlight here. For example, we created a COVID leave of 10 weeks or 50 working days. And this is a COVID leave that wasn't just for and isn't just for people who are dealing with themselves or a loved one who they have to care for who's suffering from COVID, but actually to also be responsive to the burnout that we're seeing where people have to balance all of these caregiving responsibilities. We had to recognize that people are no longer just working at home. They weren't just working at home at a home office, but they actually also had a daycare that they were running, an elementary school that they were running, a home for older adults that they were running, that they had dependents who were living with them so they could be safe during the pandemic, that they were balancing so much. And so that's why we created things like COVID Leave, why we work with vendors to create programs to support people who are navigating the system for older adults that they care for. That's why we've increased our wellness benefits, because so often it's the caregiver that gets lost in all of this. The caregiver needs to be cared for as well. And so this is in addition to the other things we already do around, paternity and maternity leave and childcare reimbursement. But it's these wraparound services, looking at the caregiver as a holistic person so that they feel taken care of, so that they can focus at work on what they need to do to be productive and also to feel good about their role at home.
I like what you said about it's the caregiver that needs to be taken care of as well. And it's obviously clear that Meta has invested a lot in taking care of its employees. So thank you for sharing that with us. But let's zoom out a little bit. From your perspective, why is it so important for employers to take care of their caregiving employees?
So we know that it's the right thing to do, but it's also the smart thing to do. You look at what's happening in the economy. We have rising vaccination rates, which is a great thing. And it means that there are more people heading back to work and more employers vying for talent. But there's a conundrum. There's more job openings than there are employees and workers to fill those job openings. And it's hitting record numbers. So in terms of that gap. And so this really sets up a competition for employers to vie for that talent. And the question is, what are you going to do about it? And we know there's good evidence that tells us that supportive workplace policies for working families leads to better attraction of talent. It leads to better retention of talent. It leads workers to be more productive because they don't have to worry about all the responsibilities they have as much, and they're able to focus at work. And so it's clear that we need to keep bolstering the policies we have, keep getting creative in order to prioritize our employees' welfare so they can thrive at work. Like I said, we want people to feel like they are taken care of by us so that they can take care of the people at home. And, finally, I'll say, we know that women disproportionately bear these caregiving responsibilities, as I said before. And so looking at what's happened to the economy, how more women have left the workforce than men, how they have faced this crunch in a way that they haven't in prior historic times. These policies really have to rise to this challenge. And we're also up for the challenge to be a role model to other companies, because we all need to play our role in society, whether you're government doing policy and regulation, or a private sector entity who's working to lead with the best policies possible to help encourage other private sector partners to do the same.
And I know that today Meta is releasing a new report on gender equity at home. What are some of the biggest insights?
Yeah, thanks so much for that question. We're really excited about this report. In order to design effective policies at home, in government, we need to understand what people are experiencing. And so we are really excited to announce that today we're launching the Gender Equality Survey at Home. This is one of the world's largest online surveys. It has nearly 100,000 respondents. It's in 65 languages and 200 geographies. And we really tried to fill some of the gaps in data. And we were really pleased to work with some really strong, amazing leaders in this space, like the World Bank, UNICEF, CARE, Ladysmith, who are also looking for data that can help guide decision-making. And what we learned is that most of these insights affirm what we already know. Caregiving is a truly universal challenge, and it's something that women disproportionately bear. They are the disproportionate caregivers at home. And so these insights can help guide our decision-making on topics across that spectrum, but on other topics as well that I won't get too into today, but that you should check out around how people are delaying their plans to grow their families, something that impacts caregiving responsibilities, and how they're incorporating decisions around employment with such future planning. So 2 quick highlights on this that I just want to raise. One is that the caregiving gender gap has broadened since 2020. So when we did this report in 2020, we saw that more women than men identified as being the main caregiver in the household, but that gap has grown. So now there's a 12% gap between women reporting that they're the main caregiver and men, and it's growing. So that's significant, that growth. It really underpins that this discrepancy needs to be closed in order to achieve gender equality. The second stat that I just want to highlight really quickly is that across the US and Canada, women were more likely than men to report that child care interfered with work. Case in point, right? This is exactly what we're talking about today. And it's significant that that gender gap is larger in North America than in any other region. Not surprising given some of the current conversation about our lack of care infrastructure. So in many ways, none of this is surprising because it unfortunately tracks to what we already know, but it shows that the trends aren't going away. And it gives even more credence to why we need to have supportive policies to support employees at work so that they can be responsive to their home responsibilities.
Avra, thank you for that data. As two full-time working moms, this matters to us, but you also said it's truly a universal challenge. So thank you for joining me today. I appreciate your insights and have a great day.
Thank you so much for having me on this important topic.
And now back to my colleague, Erica.
Thanks, Kristen. Joining me now is our final guest, Fatima Goss Graves, who's the president and CEO of the National Women's Law Center. She's joining me from Washington, D.C.
Good morning.
So you really can't overstate the extent to which the childcare crisis has hurt women in our society here, right? I'm just going to rattle off some numbers here. Wall Street Journal reports that more than 1 million moms are still missing from the workforce. And at the same time, childcare centers and elder care centers around the country are feeling the squeeze, and many have even shut down. But, cases are starting to fall. Kids can get the vaccine now. Is this crisis for women going to disappear alongside the pandemic, or are we going to see this for the next few years and beyond?
So today, women's share of the workforce is back to where we were in 1988 levels. So this is not a thing that's going to be solved overnight. And part of that problem is that we had a care crisis that was largely invisible even before the pandemic. So even before the pandemic, mostly moms were struggling to stay connected to work. Even before the pandemic, we had huge childcare shortages, whole parts of the country where people considered them to be childcare deserts because you couldn't find quality childcare in your area. So it is going to take some time and actually a really significant investment.
And so is there any silver lining here? Like, did the pandemic expose this in a way that we hadn't seen before? You've been working in this space for a long time. Are people paying more attention finally?
People are paying attention because it's so deeply personal. And they finally woke up to the fact that our care infrastructure was basically based on two things. It was based on underpaying a largely women of color workforce. And that isn't working in the midst of this really fantastic and important labor realignment we're experiencing right now as a country. But it was also based on lots of invisible labor of mostly women who took time off of work by themselves, who sort of kept their families and our economy going. Neither of those things work during a pandemic, and they won't work outside of a pandemic.
And how is this affecting women in different places in their lives in the country? I mean, how is it affecting lower income women versus high earners, white women versus women of color? Who's hurting here? Or is it kind of blanketing, all women?
Well, everyone is experiencing some form of care crisis. And I don't want to discount the care crisis that women who have far more means are facing. They too are struggling to find childcare support and more. But the truth of the matter is, from the start of the pandemic, most of the frontline workers were women, and they were majority Black and brown women. A third of Black women have been working throughout the pandemic. They never had their quarantine moment. And what that means is not having a solid care infrastructure is falling on them really hard. It matters that they don't have paid leave when a family member gets sick. It matters that they can't find and afford childcare because 1 in 10 childcare workers have not returned to their profession.
And then how about on the side of the kids? How is this affecting them when their moms are going through this really, tough time?
I worry so much about the stress that families are experiencing. The stress that moms are experiencing ends up becoming the stress that their children are experiencing. And as a country, we are still wading through the trauma, really, of a pandemic. It is just made far worse when you don't have strong care support. So it's a reminder to me, I think, that investments in caregiving are investments in families and investments in economy, but they're also just investments in the well-being and futures of our children.
So yeah, I want to turn to solutions. How big of an investment do we need? What do we need specifically from the federal government on this?
Well, we have a plan on the table in Build Back Better, right? The president at the start of the administration laid out a vision for an investment in our care infrastructure alongside investments in the more traditional hard hat infrastructure. Both were important, and I'd posit that the roads and bridges and technology infrastructure that's on its way. And it was really exciting that that work is happening. It will not be successful if we cannot get more workers into the workforce, and that's going to require a care investment. So an investment in childcare at about $450 billion is what we are seeking over several years. An investment in home and community-based services so that we can actually have our care workers paid dignity wages, which will help people seeking elder and disability care actually find care workers, and an investment in the first national paid family leave program. We have to have all three.
Can you take me through why each part of those three are important and then what they add to this entire equation?
Right. Well, so for both childcare and for home care, one of the things that is super clear is that our families can't afford to pay more. Right now, families in this country are paying to work, basically. You have a lot of women paying giant parts of their income on childcare because childcare is so expensive. In some states, it's more expensive than state tuition, but it's an expensive cost for a good reason. These are sort of treasured things, young children. And so families can't afford to pay more, but the solution is not paying our workers less. We can't afford to do that either, in part because of the dignity and experiences for workers, but in part because you won't be able to get enough people to do it. So we need a major investment to solve that problem. We also need a similar investment in home care. They have the similar challenge of not having enough workers because of the pay, and that requires investing in our Medicaid program. And finally, we need a paid family leave program. And one of the things that we should have really learned in the pandemic is that it is better for workers to be able to take leave when they need it, either because of their own serious illness or to care for a loved one. And it's the type of investment that keeps workers connected to jobs rather than pushed out of the workplace entirely because they can't afford to do the work of care, which is work women do. It's just unacknowledged work.
The way you're putting it, it makes it so clear. The entire economy hinges on the caregiving economy. And then, that's the government side of things. What about businesses? A lot of what we've seen from businesses in the past has frankly been cruel in terms of letting workers take time off for caregiving. What do the companies that want to be competitive and recruit talent in the future need to offer?
I think businesses who think everything is going to snap back in some post-pandemic world and that people can pretend they no longer have children or families that they care for are making a giant mistake. What they should have hopefully learned in this period is how essential caregiving is for workers and that they can do their part. They can do their part by supporting and offering paid family leave programs that go above and beyond whatever the standard ends up being at the federal level. They can do their part by offering fair schedules and working relationships that allow people to work and care for their families. And they must do their part by not engaging in caregiver discrimination, not limiting the potential of people who are caregivers, not shunting them in a corner or creating some new wave mommy track that limits their opportunities and their financial stability.
And we're in the trenches of this right now. Are you seeing anything either from, policymakers or business leaders that gives you hope that we're going to come out of this and come out stronger?
I have to say, I have been given the most hope by people in this country who've continued to speak out and demand that there be a major investment in caregiving alongside the really critical investments in infrastructure and joining the two. And our leaders are responding. So I was hopeful when it was first on the president's agenda. I actually think the House is going to pass Build Back Better, and that they're going to do it in a way that sets us on a path on a major caregiving investment. And the Senate will be forced to follow. This is not a time in our history where we can run away from doing the important things that our country needs, that our communities need, and that our economy needs.
Thanks so much for joining us and sharing your expertise, Fatima.
Thank you for having me.
Thank you all for joining this afternoon for another virtual conversation that has made everyone smarter, faster. For more info and the latest on the caregiving crisis and what's coming next, sign up for my Axios What's Next newsletter. Visit axios.com/newsletters or visit us on the Axios app. Thank you all for joining, and we'll see you soon on axios.com.